rather than pontificate about them. One of the reflections that that supported employment responds to what people are interested in and pays attention to their preferences is that people who raise their hands and sign up for supported employment tend to stay in the service and have success. Whereas if you look at all these other professional training programs, you know, they all have huge dropout rates. They're not what people are interested in. Professionals often say to me, well, but clients don't know when they're ready to work, and you know, many of them are not ready to work. We did a study in Southeast DC. Any of you been to Southeast DC? It's a tough area. And we recruited clients out of shelters. They have to be homeless, they have to be psychotic, and they have to be cocaine addicted. So, you know, these are not your top choices that VR usually likes to fund. But we took everybody that raised their hands, and lots of them, you know, did a randomized controlled trial. Lots of them got to competitive jobs. Many of them 10, 15 years later are still employed. Working helped them get off cocaine. Working helped them get stably housed. We know that across lots of studies that if you help people find a job that is consistent with you know, their preferences, they're more satisfied, they stay twice as long, they do much better in the job. We have some data now on young people showing that if you really pay attention to whether people want to return to work or return to school or do both, pay attention to their preferences, again, you know, the outcomes are much better. Here's some data from Vermont. This is really interesting, and it tells you something about our failure to provide basic education to people. In this study, benefits counselors merely sat down with people and explained to them in detail what would happen to their benefits if they went to work. Because, you know, the benefit system is so complicated that very few people really understand this, and most of us are far, far from understanding it. But what this slide shows is the group on the black line are the clients who got benefits counseling at this point in time. And you can see earnings went up automatically. They went to work and they worked more hours, just knowing what the realities of the system are, which we don't usually tell them. There are now 18 randomized controlled trials of supported employment. Every one of them shows that supported employment is more effective at getting people back to work than other interventions. Once people get back to work, all the evidence is that they change jobs a few times, but once they're launched on a work trajectory, the longer you follow them, the more they work and the more likely they are to get out of the mental health system. Here's a study that was just completed at UCLA where we looked at young people having the first episode of psychosis. You know, the clinical wisdom has always been that these folks need a timeout and they should stay at home and get stable for a while and not try to get back into school or work immediately. And the UCLA folks said, well, why don't we try instead giving them very assertive supported education, supported employment right away while they're in the midst of a first psychotic episode. And you can see that over 95% of them were able to get back into school or work. Many of them were able to avoid going on disability because of these early services. This study's now been replicated in 4 places around the world. Several other countries have gone ahead and adopted this model nationwide. The U.S., as you probably know, the NIMH is just getting ready to fund a big trial that will occur in many states around the country called RAISE, or Recovery After Initial Schizophrenic Episode. And it's all based on this premise that if we really provided good services to people early on, we wouldn't have to be so worried about disability because we could prevent lots of disability. Here's some economic data. These are from New Hampshire, and they're following people for 10 years who were high-cost clients. And Clients on the bottom, on the blue line, are those who became steady workers over time by participating in supported employment. Those on the top, in the pink line, were people who didn't get employment services or didn't go to work. And the net effect here is that the cost difference over 10 years was slightly over $160,000. So the mental health system saves $160,000 for every client who becomes a steady employee over time. And yet, it costs $4,000 or $5,000 to provide this service to a person and saves the system $160,000, but most states have decided they can't afford this. We recently did a benefit cost analysis on this topic with economists for the Social Security Administration, and even with the most conservative possible estimates in all of our sensitivity analyses, the Social Security Administration still ends up saving over $100 million by providing supported employment services to people. So, why do we persist in providing expensive, unproved medications to people for hundreds of billions of dollars, and even treating them toxically with polypharmacy in a great majority of cases, and we provide supported employment to almost no one? That's a question that I hope you'll keep thinking about, and thinking about how you can change in this country. The reality is in our country that big money and advertising and profit motives and guild interests and politics determine what gets funded and what services get provided, not what's helpful to people and not what people want. I mean, you go from state to state now, as I do much of the time, and I can't tell you how often I hear this story from state and mental health people and other administrators. Yes, we know we're providing a service that's harmful to people, but this is what Medicaid pays for, and we won't be able to stay in business if we switch over to things that would really be helpful to people. Well, we should all be outraged about that. Don't just leave it up to Mental Health America and NAMI. We should all be outraged about this and talk to our congressional people about it. This is the first known randomized clinical trial. In 1601, a captain in the British Navy decided that a little bit of lemon juice might help prevent so many sailors from dying of scurvy. And so on a trip around the world, he randomly assigned the sailors on one ship to get lemon juice every day. And you can see that at the halfway point, nobody had died in the lemon juice ship, and 40% of the sailors died in the other ships of scurvy. Of course, the sailors in the lemon juice ship were all complaining. They thought they should be getting grog instead of lemon juice. So with that randomized controlled trial, how long do you think it took the British Navy to adopt the evidence-based practice of using lemon juice? 1 year to 1602? 25 years to 1625? Well, you probably all figured out that the answer is 200 years. 200 years, that's how closely we pay attention to science in the Western world. And that continues today. Here's a slide on the diffusion of beta blockers for people who are post-heart attack. We've had the knowledge for many years that virtually everybody should be on beta blockers after a heart attack, and it prevents mortality.